One very good question that I had from a patient this week is how do I decide if someone is a good candidate for a hair transplant procedure? One of the big misconceptions about hair restoration is that everyone and anyone with hair loss is automatically considered a good candidate for having surgery. That's simply not true. One of the most important parts of my job is to decide when to perform a hair transplant and when someone shouldn't have one at all. Every consultation, I view it as being different. Each individual case different, every patient is different, but there are, I believe, let's say by numbers, maybe 6 key things that I assess before committing and embarking on this surgical process. First of all, I would say the patient's age. Age isn't a strict rule, but it does matter. If someone is, let's say, far too young and their hair loss is progressing quickly, then performing surgery too early in life will most certainly create problems later. A low, dense hairline may look attractive today and in a year or two, but if the surrounding hair continues to thin over the next 10 to 20 years, then the result will no longer look natural. Therefore, sometimes the best decision will be to wait. Hair transplantation should fit into your future and let's say into your overall future and not just solve today's concern. Second point would be the stability of the hair loss. The next question. If the hair loss is stable, or on the other hand, it may have been progressing rapidly, has it slowed down? Are there any signs that it might continue? And quite often it does. In some patients, medical treatment might help in stabilizing this hair loss before surgery is considered. Operating on unstable hair loss areas without a long-term plan can greatly increase the likelihood of needing further procedure much sooner than expected. Third point would be what is the pattern of hair loss. I will need to assess the pattern of hair loss quite often using the Norwood classification or other scales. This will help me understand not only how much hair has already been lost, but also where the pattern might be heading. Someone with, let's say, a small recession today may eventually develop a much more extensive hair loss, and that will change how I need to design the hairline, how to decide on using the donor area, and having that strategic reserve for the future. It's not important just to restore hair today, but to restore it in an intelligent manner. Fourth point would be the donor area quality. This is your most valuable resource because it is finite, and during the examination I will have to assess all the characteristics of the donor area, the density, the thickness of the hair's texture, color, signs of miniaturization, any scarring, any concerns there, any inflammation process, previous surgery, scars, and so on. Two patients with the same degree of baldness can have completely different donor area reserves, and that's why each and every treatment plan must be individualized. Fifth topic would be expectations. A successful hair transplant isn't just about the surgery, it's about managing the expectations. I always ask patients what they hope to achieve. Are their goals realistic? Do they understand the limitations of this procedure? Do they appreciate that basically a hair transplant redistributes existing hair? It does not create new hair, and the hair does not regrow in the donor area after being extracted. The happiest patients are usually those who have realistic expectations, a clear understanding, and they also know what is achievable. Sixth point would be future planning. I ask myself one important question. Will this plan still make sense 10, 20 years from now on? Hair restoration isn't just about today's photographs or an event coming up next year. It's about how will you look as you continue to age. That's why I often recommend a conservative hairline approach, a donor area preservation, planning for the possibility of future hair loss, because quite often this is the case. A responsible surgeon shouldn't just think about the first surgery, they should also think about every decision that might follow after that. Not everyone should have a hair transplant, and that's a certainty. And that's also perfectly okay. Sometimes surgery isn't the right answer, and that's valid for a lot of cosmetic procedures. Sometimes medical treatment is the very best step and the first step indicated. Sometimes waiting might be the wisest decision. The best consultation isn't about finding the reasons to operate and rushing into making that decision. It's about finding the right treatment for the right patient at the right time. Good hair restoration shouldn't be measured by how many procedures a certain clinic surgeon performs. It should be, let's say, measured by how many patients, first of all, receive the right advice. And even when that advice might be not yet, or surgery is not an indication in your case.